So let's talk about some common digestive disorders. Um, Starting with the mouth and esophageal disorders, you have gingivitis, which is basically a gum disease um, caused by bacteria, which can damage the gums around your teeth and make chewing difficult. There are other periodontal diseases that can cause that too. Gingivitis is a common one. Some people have swallowing problems, also known as dysphagia, um, which of course just makes it difficult to eat. The people with certain diseases may have those problems. The elderly commonly have swallowing problems. Perhaps someone has, a thyroid swelling or cancer of the esophagus. All of those things can cause swallowing problems. Your problems of the esophagus start with basic heartburn or acid reflux. We talked about this earlier in this lecture. Um, that can be caused just by a weak lower esophageal sphincter or LES, and which allows the acid from the stomach to go back up into the esophagus, and this creates a feeling of heartburn or chest pain um, for a person. It's also known as GER or GERD, gastroesophageal reflux disease, um, which you'll see, advertisements all the time for Prilosec or Zantac to help the symptoms of those disorders. It can get fairly severe and erode um, people's esophagus and cause bleeding and tears in the esophagus if it's a constant problem. Many of us average people may have it occasionally, depending on what we choose to eat, and then we can just avoid those foods. Esophagitis is another thing caused by a hiatal hernia, and the hiatal hernia is, around the diaphragm area. Some other disorders, starting at the stomach, something called gastroenteritis, which is basically known as stomach flu. Usually this is caused by a virus or bacteria. People may have vomiting, diarrhea, stomach pain if they're experiencing that disorder. A peptic ulcer, which is a sore or erosion in the stomach lining, and that is fairly common. It can be brought on by stress. It can be brought on by medications of various sorts. So all kinds of, you know, ulcers can form in a person with this disorder. There is gallbladder diseases, gallstones. I'm sure some of you have experienced family members that may have had gallstones that had to be removed. It's when the bile in the bladder crystallizes and hardens and small stones form. And this can cause your gallbladder duct to clog if one gets in there, causes a lot of pain. And usually when it gets really bad, surgery may be in order. Okay, and then there's other diseases and or disorders, I should say, not diseases necessarily. And one of them no one likes to talk about is gas or flatulence. And a lot of times this results from the way we eat. If we eat too fast, perhaps, you can ingest a lot of gas when you're eating. If you drink sodas, that have CO2 added to them to make bubbles, and those bubbles don't easily come back up, um, that can cause gas or burping. Foods like beans and foods that have what's called oligosaccharides. It's a form of sugar that's not easily digestible by humans. Um, you can have gas as well as having other vegetables. Lactose, if you're lactose intolerant and don't digest milk sugar very easily, gas can form. Also, a lot of people don't think about the sugar alcohols used in sugar-free products. For example, sugar-free gums or candies use maybe sorbitol or mannitol, and a lot of times that causes problems for people. Other sweeteners like some of the stevias or asulfamine um, can cause issues for certain people. Constipation and diarrhea, that's a very variable state. Some people can have a chronic state of that if they have a certain digestive disorder. Sometimes it can be just temporarily. Usually when you talk to a GI doc, they'll prescribe fiber for either disorder because fiber is bulking and it can bulk up the stool so you would not have diarrhea, or it can, relieve constipation by moving stool through your system. Um, but, drinking enough water in either case is helpful because if you're having constipation, being fully hydrated is helpful. And if you're having diarrhea, you are losing water and electrolytes, so you want to replenish your fluids. And as a result of either one of those, hemorrhoids can be a result, and that's a swelling or inflammation in the vein that ends around your rectum or anus, where they bulge out and can get swollen and red, and they can be itchy and painful. Some more serious digestive disorders that you may be familiar with or may encounter in your practices are irritable bowel syndrome, which is a disorder where you're functional, but there's changes to your colon rhythm, meaning you have changes between constipation, diarrhea, you may have a lot of pain, you may have more gassiness. A lot of this is brought on by food, stress. There may be some genetic component to it, or there could be even some autoimmune component to having irritable bowel syndrome. Celiac disease is becoming increasingly well known. Truly only 1%, I believe, of the population has this disorder, but you see a lot of gluten-free diets, a lot of gluten-free products out there, people talking about being gluten-free, but only a small percentage of people truly have celiac disease, which is an autoimmune disorder related to gluten consumption, and is quite serious. Children with celiac disease will have a failure to thrive. Their bone development might be decreased. They'll have all kinds of absorption issues, which will lead them to more problems. They can become very sick and hospitalized. Adults can have severe problems with it as well, with alternating diarrhea, constipation, extreme pain, fatigue, a whole myriad of symptoms. I'm going to play this recording from the Mayo Clinic. It's just a minute or two long, and he'll talk to you more about celiac disease.
Hello, my name is Joe Murray. I'm a gastroenterologist at the Mayo Clinic in Rochester, Minnesota. Today we're going to talk about a recent paper published in the American Journal of Gastroenterology. This paper, from a group in Boston, examined their experience of trying to differentiate between celiac disease and non-celiac gluten sensitivity in a group of over 200 patients that they saw. And these were patients who had had incomplete or no testing for celiac disease before starting on a gluten-free diet. And what they found was interesting and instructive. Patients who had symptoms of malabsorption, patients who were deficient in certain nutrients, had a family history of celiac disease, or a history of autoimmune disease, were much more likely to have celiac disease than patients who lacked any of those features. Patients who had some blood testing for celiac disease done before going on a gluten-free diet, if their tests were positive, this was usually a strong indicator of the presence of celiac disease, especially if the test results were very high or more than twice the upper limit of normal. Whereas patients who lacked those features or lacked the antibody tests were much less likely to have celiac disease. They also point out the usefulness of genetic testing in patients who have some of the features of celiac disease, or possibly blood tests that are borderline or weak positive, that doing genetic testing might be helpful to help select out those patients who need further testing and those who do not. This points out the importance of being tested for celiac disease before going gluten-free. It's a lot easier to test before gluten is removed from the diet and to do the right tests, completing either confirmation or ruling out of celiac disease before trying a gluten-free diet. Thank you.
So as you heard in the video, Dr. Murray recommended that testing for celiac before taking on a gluten-free diet. Gluten-free diet's very difficult to maintain because of the amount of wheat products and ingredients that contain gluten in various foods. So having a test either via a blood test to test your IgA titer, which is an immunoglobulin, or perhaps a more invasive test like a biopsy would be in order before taking on a strict gluten-free diet. Another disease that you may have heard of is Crohn's disease. This is a severe inflammatory bowel disease. The people who have that suffer with diarrhea, pain, perhaps some constipation. The intestine can become inflamed and diseased, and sometimes surgery is in order for these folks to get some relief. Of course, cancer is never good, and colon cancer is one of the leading forms of cancer. But if it's detected early, it's highly curable. Oftentimes, people go unscreened, or they don't realize they have this form of cancer. The recommendation now is once you hit 50 years old to have a colonoscopy every 5 years to detect polyps and cancer of the colon. So it's always important to do these screenings when they come up. The final disorder would be diverticulosis, and this is when pockets or bulges form in weak spots in the intestinal wall, and that's caused from a buildup of pressure, perhaps by the passing of stool, and parts of digested material get stuck in these pockets, and when that happens, those pockets can become inflamed, and at that point it's called diverticulitis, and it's very uncomfortable for people who have this disorder. So this rounds out our talk of the digestive processes. Here's some of the disorders I already mentioned. That's a table that's in your book. So you can review that, look at the symptoms, causes, and treatments. I hope listening to these videos has worked out for you, and I tried to make them shorter so that it wasn't so much to listen to at once. Good luck on your quiz. Be sure to read through your book or listen to this. Hopefully you listen to this before you take your quiz. And then I'll be meeting you in the lab for your next exam. So have a great day.